Well, the race is on to get Massachusetts residents registered and ready for the potential surge in vaccine supply this spring.
Here to answer your questions is Dr. Ali Raja, the Executive Vice Chair for Emergency Medicine at Mass General Hospital. Dr. Raja, thank you for joining us. The White House says it will have shots available for all 300 million adults in the U.S. by the end of May. What do you think should be the top priority for public health officials between now and then?
It's a great question, Katie. I think the logistics of distribution are going to be really important, not just getting people scheduled now, and we've seen how hard that is, but also getting ready for the wider rollout of all adults. Once we get those vaccines in hand, we need to already be ready and have the appointments already scheduled and ready to go.
Okay, pre-registration important. Everybody needs to check that out. And President Biden wants states to make vaccines available to all adults by May 1st. So here in Massachusetts, we are only in phase 2 of the rollout. Are you concerned that some people will get even left further behind when the vaccines become available to everyone?
I am, Rondella, but I think that we can work really hard not to leave any high priority groups behind. The May 1st deadline gives us about 7 weeks to get ready to get higher risk patients scheduled and hopefully started on their vaccinations before then. Like you just mentioned, the pre-registration system that opened up yesterday is a great start. And I recommend that everybody who is currently eligible get on the state's website and pre-register right now.
Yeah, it's a good idea and it's easy. The state released new data about the low vaccination rates among Hispanics in hard-hit communities such as Lawrence, Chelsea, and Fitchburg. What is your reaction to the numbers and what needs to be done to improve them?
I'm disappointed. Frankly, I'm really disappointed in the numbers. But what they do is they indicate that the longstanding healthcare inequities that COVID is just making worse are continuing. But I think they serve as a reminder to all of us that we need to try even harder to get out and understand why people are hesitant and get the vaccine and build trust by answering their questions.
Let's think back. 1 year ago, it was today the U.S. declared a national emergency due to the pandemic. Locally, the Boston Marathon was canceled for the first time ever. As a doctor on the front line, what was going through your mind on that day?
Rondella, when I think back, we were actually already in the thick of it. If you'll remember, Mass General was one of the 2 sites in the city that was already screening and checking patients or people who had been to that biotech conference that turned out to be a super spreader event. So we were already in the thick of it. I don't think that any of us thought that it would go on for so long and be so severe for us and our patients, but I think we were starting to get an inkling of it.
Okay, thank you for sharing and thank you for your insights. Thank you, Dr. Ali Raja, the Executive Vice Chair of Emergency Medicine at Mass General Hospital.
Thank you.